Hello everybody. My name is Harshita, and continuing into this lecture series of abdominal cavity, we have priorly seen in the last video about the morphological features, basic introduction, and location of the liver over here. Now, in this video, we'll be discussing about the relations of the liver. That is, we'll start with peritoneal relation. Then we'll be discussing about the visceral relations also. Okay, so now starting on with the relations, the peritoneal relation. Now almost most of the liver is covered by peritoneum. The area which is matlab all of the liver is covered by peritoneum, but there are certain areas which are actually not covered by the peritoneum. So they are four areas. First is the triangular bare area, then there is groove for inferior vena cava, there is fossa for gallbladder, and area for the attachment of lesser omentum. So if you look over here in this diagram, this is the area which is known as the bare area. This is the IVC, or इसके नीचे there will be a groove which will be present for placement of that IVC over there. So that groove won't have any kind of peritoneal relation. Also, this groove which is there for the ligamentum venosum will also have no peritoneal cover, as well as this fossa for gallbladder will also be having no particular covering of peritoneum. So clear, these are the peritoneal relation. Now next is visceral relation. Now visceral relation, as we have seen in the previous lecture, the part 1 of liver, we have seen over there are five surfaces which are considering for the liver's morphology. So five surfaces which are anterior, posterior, inferior, superior, and the right lateral, right? So firstly, let's see what is the relation for anterior surface. So anterior surface is related to the xiphoid process, and very important, to the diaphragm, which is separating the pleura from the liver up to the 10th rib. Okay, if you look over here in this diagram, you can see this is the liver which is present over here, and above it is a covering of the diaphragm, and this is the xiphoid process which is present over here. Fine, one second. Okay, so over here this is the liver, and the one which is covering it entirely is the diaphragm, and above the diaphragm there will be a xiphoid process which will be present. Clear? So these are the two relations of anterior surface. Now next is the posterior surface. Now in the posterior surface, look into this diagram. Okay, so this is, as you can see, a nearly of triangular like area, right? This is somewhat like triangular area, so that is why it is said that it is triangular. Second, we have learned that we have a bare area, right? So the bare area which is present over here, this area is the bare area. This covering is entirely the bare area. So the bare area will have lodgement for right suprarenal gland. Clear? It will have the right suprarenal gland. Then the groove for inferior vena cava. Now you can see this is a certain kind of depression which is present. That is actually the groove which is present for the inferior vena cava. Okay. Next is the caudate lobe. We have seen that in the posterior surface of the liver we have a caudate lobe present over here. So this caudate lobe is actually lodging the crura of the diaphragm. When we learn about the diaphragm muscle, we'll start with the diaphragm muscle. At that time, we'll come to know what is actually the crura of the diaphragm. For now, you have to just learn that in the caudate lobe, we have crura of the diaphragm. Okay. Now, next is fissure for ligamentum venosum. This is actually the fissure which is present. Again, it will have the two layers of the lesser omentum. We have learned about the lesser omentum, the greater omentum. You can see it in the channel present, and there I have posted all the abdominal cavity stuff, and you can go and learn over there if you don't know what is lesser omentum and what are the layers of the lesser omentum. Okay, now moving forward, posterior surface of the left lobe. Now, this was about the right lobe. About the left lobe, if we talk, the left lobe of the posterior surface has esophageal impression. Clear? So, this is about the posterior surface. Now, let's look at the inferior surface. Now, this is the part which is left is known as the inferior surface. So, the inferior surface of the left lobe has gastric impression. Now, it's pretty common sense that the stomach is present on the left side of the abdominal quadrant, so it is obvious that the left lobe will accommodate the gastric impression, right? So uh, as you can see over here that we are having the this thing, what is that, gastric impression. Okay, so this is the gastric impression. Then second thing which we have is the fissure for ligamentum teres. Ligamentum teres is the one which we have learned earlier, that ligamentum teres is an intra uterine life structure which is now being modified for the for the body after birth. So it passes from inferior border of the liver to the posta porta hepatis. So see, this is the layer of the ligament which is going, and that is the fissure for ligamentum teres. Fine. Then we have next, which is the caudate lobe, which is present over here. The caudate lobe will have the pylorus, or the first part of the duodenum. Okay. Then fossa for gallbladder, that we all know, ये जो fossa है, this is for the fossa for gallbladder, which will lie on the right to the quadrate lobe. On the right of this fossa, there is an area which is called as colic impression. Now see, this is caudate lobe. Right to it is the fossa for gallbladder, or fossa for the gallbladder के भी right में this area which you are seeing over here is for the colic impression. Means the colon will come and get accommodated over here. ठीक है, the right flexure of the colon will get accommodated over here. Clear? Then this is about, so we have covered anterior surface, posterior surface, inferior surface, and now lastly we'll be looking at the right surface. So the right lateral surface is quadrilateral and it is concave. As you can see, this is quadrilateral and this is concave, like this. So fine. Then it is related to the diaphragm, opposite to the 7th and 11th rib in the mid axillary line, and diaphragm separates the pleura at the 10th rib and lungs at the 8th rib from the liver. Sorry. Okay, so this is all about the relations of the liver. एक last surface is left, that is the superior surface. The superior surface, again it is quadrilateral and concave in between. The depression in between two lobes is called as the cardiac surface or the cardiac notch. Now when we were studying stomach, I have explained you about the cardiac notch, and that cardiac notch is actually being present over here in the superior surface. Clear? So these are the 5 surfaces which we have covered in this video. Now in the next segment of the video, that is part 3, we'll be covering about the various ligaments which are being attached to the liver. There are certain ligaments which are of importance. This is the important part, and it is definitely being asked as a long answer or a short answer in your university papers as well as in the college papers, which are of great importance, and you must know it. Even as a for being a good doctor, you should like understand it very nicely. And then the last part, that is part 4, we'll be covering about the remaining part, that is the blood supply, the venous drainage, the nerve supply, the hepatic segment. This is also one of the important part, actually not for the exam but for knowledge point of view. And then we'll conclude it with the clinical anatomy part. So hope you understood it to the utmost level. I have tried my best, and any queries are being welcomed into the comment section. And thank you. Please like, share and subscribe.